a little bit about therapies and treatments as we, continue to move along through this pandemic? The therapy options have evolved some. Can you go into a little bit on that?
We've learned a lot about this virus over the last several months. I think early in the pandemic, it was really supportive. Oxygen, hydration, treating other infections when we would identify those, putting you on a ventilator or other breathing devices when that was needed. And that was really where we were at. Antiviral medications like remdesivir have come out and we're using those. I think the studies are still ongoing to decide how effective they are, but there's certainly some effect, and a lot of these have been approved for use. Dexamethasone, which is a steroid, has been shown in a number of studies to have some benefit, and anecdotally we think it is helping. So a lot of people get dexamethasone or some steroid therapy. Certainly all the supportive things that we continue to do. Convalescent plasma is another thing that early on in this pandemic, we knew that if we took serum from somebody that has already had COVID, get the antibodies out of that, infuse it like a blood transfusion essentially into somebody else, called convalescent plasma therapy, it can actually improve things. Studies are still ongoing whether how effective that is, but we're still implementing that type of therapy. One of the newer ones is what's called monoclonal antibodies. So these are not from patients, but manufactured antibodies. Regeneron is kind of the name of the company that came out with one of the first products. I think we all remember President Trump when he had COVID, got this as an experimental therapy, literally just several weeks ago. And now it is approved for emergency use authorization. So we're doing Regeneron monoclonal antibody infusions on people. And we're doing that right here in Peter. It's an infusion. It takes about an hour. It's done really on people early in the course of the disease, people that are at risk of becoming sicker and potentially needing hospitalization. So people with immune compromised states, diabetes, heart disease, lung disease, advanced age. We're identifying those patients and trying to get them lined up for monoclonal antibody infusions. And we're fairly optimistic that that's going to be beneficial as well. And that's kind of where we're at. I know there's a lot of research being done on everything from vitamin C to all sorts of other vitamins and zinc, and and then there's been some things that have come and gone, and the hydroxychloroquine thing was big for a while. Z-Pax or Zithromax, which is an antibiotic, those things really have proven to not be effective and maybe even harmful. So they are not recommended. In fact, are contraindicated now. And then there's some things out there. There's a medicine called ivermectin, which is it's an interesting medication. It's been around forever. It's typically used as an antiparasitic. And there's some research being done on it. I would just say nobody really knows. I probably wouldn't take it myself at this point, but it's being investigated. And I know it's out in the social media and so forth as a potential therapy. Amongst a whole host of other, I'm sure, I would just call weird therapies that I don't know. A lot of them are, not science-based and so forth. But I just know that there's just a ton of research being done. The standard therapies that we're doing are what I just talked about. So.
All right. It's just amazing the medical advancements that have happened in such a short amount of time. And it's really great how responsive you guys are as our main hospital here in Central South Dakota to continue to evolve as those therapies have changed as well. So